Okay. Today what we're going to do is we're going to show you how we can use Kinesio Tape to help someone with a musculoskeletal problem in their upper extremity. So we have our patient here today who's presenting with pain with elbow extension and with extension of the wrist, as well as pronation of the wrist. So what we're going to do is use Kinesio Tape on two muscles to help keep those muscles, which are very active and overworked. We're going to use Kinesio Tape to help calm the muscles down and keep them from over-contracting. So the first muscle we're going to do, we use our blue tape, is the flexor carpi radialis muscle. So this muscle begins up here in the medial epicondyle, and it extends down into the wrist. We're concerned right now with the muscle belly. It's very tender, and you can see it's actually a little bit bigger than the other one. So to do this, we're going to measure our piece of tape. So from about right here. We're going to even off our edges. And we're going to use our Y-shaped pattern, which is the best for this type of technique. Now again, since we have a muscle here that's over-contracted, what we want to do is allow the Kinesio Tape to actually keep the muscle from contracting. So to do that, we're going to start at our insertion, and we're going to work up towards the origin. And what that'll do is that'll actually help to keep the muscle from contracting. So since it really hurts him to actually move the arm, we're going to take it as far into the end range as we can before pain, so just tell me when. It's like right about there? Yeah. Okay, so we're going to stretch the muscle as far as we can. We're going to let the tape do the rest of the action. So we kind of flick the edge of the tape off. We want to be careful not to touch the tape so that it keeps the glue. So we're going to start about the distal third of the forearm here. We're going to lay down our base. And from here, we're going to take our tape up. Now at this point, I'm going to use just a little bit of tension, from 0 to 15% of the full elasticity of the tape. And we're going to really surround the muscle belly. Second. There we go. Now from here, I'm just going to let the glue take its hold. Okay, and that's for the flexor carpi radialis muscle. Now what we want to do is do the same thing with the pronator teres. That again is the muscle that does pronation, which is painful for him. So we're going to do the same concept. It's going to be starting at the insertion of the muscle and going up to the origin to allow the muscle to relax, to keep it from contracting, to let the muscle heal. So we're going to measure our tape, starting again at the insertion, at the origin, and going over to the insertion, which is about a third of the way or so down the radius. Cut our tape. And again, we're going to use the classic Y pattern here. So remember, we're starting at the insertion of the muscle, which is right about here. And again, we're just going to take him about as far as he can go comfortably to stretch the muscle, which is right about there, right? Okay, so now he's in just about full supination, so we're stretching the muscle. We're going to put down around the insertion, right about there. And do the same with the tape there. And now again, I want to take just a very slow, almost no tension at all, 0 to 15%, working our way up to the origin of the muscle. Same thing on this side. And by rubbing down the tape, we're able to activate the glue so that it'll make sure that it doesn't come off. And this should stay for about 3 to 4 days, and he's able to shower, he can move around. This tape is meant for athletes, so he can really go about doing all of his activities that he normally would. And the idea is that the tape is just going to help him to keep these muscles from over-contracting so that the rest of the muscles can go ahead and heal around there. And that's how we tape the carpi radialis and the pronator teres.